So far, we've worked the pelvis, we've worked the upper leg. Now we're going to come to what a lot of people find is some of their favorite areas is going to be the lower leg. We're going to split it up into two regions. Right now we're going to work the front part of the lower leg. Now again, keep in mind, just because something's not sore while we're working doesn't mean that it's not getting great change. You're going to find, like with the hamstring technique, is that you might have a lot of pain in the hamstrings, but as you're rolling through that, you might not feel much of anything. It's going to be the same thing with the front of the lower leg, is that maybe you feel like you have some pain there consistently, but while you're rolling through it, it might not be that painful. Just keep that in mind, okay? So let's go ahead and switch to turn the roller long ways. And we're going to start by starting right below the knee. You're just going to rest yourself on the roller, both hands on the roller to start, making sure that you have good balance before you get into this. If you find that you have a lot of issues with lightheadedness or dizziness, this is going to be something you want to pay attention to. As we get forward, we want to make sure that you're not falling forward off the roller. If you ever feel like you're losing your balance, go ahead and just stop with that, because we're always going to have a modification for you. So the hands are now going to go out towards the front of the roller, and then nice and easy, we're going to stay up, you know, kind of tall, and we're just going to nice and slowly roll through the front of those shins. Now let's say you do have a lot of significant shin pain, you have a lot of shin splints, you're a big runner. This is going to be something that's going to really elongate that tissue on the front side, because what happens with most people is that those feet end up getting turned out, which will shorten all of this tissue. The muscle is called the tibialis anterior, and then it gets glued to the peroneals. And so as we roll through all of this tissue through here, we're going to find that people are going to have greater range of motion in the knee, they're going to have greater range of motion through the ankle, and things are just going to start moving a whole lot better. Your body is all about physics, and it's very simple, lever arms. And the more leverage you have, the longer things can be, the more fast you're going to be, the more powerful, and the more endurance you're going to have. And your pieces and parts aren't going to wear out quite as long, because you're not trying to fight against a real tight, short unit. So nice and easy, they're working forwards, they're working backwards at that sticker slow. If you find that you're having more soreness on one side than another, again, that's usually an indicator that that side's a bit more tight, and it could be tight two ways. It could be tight with it's too short, it could be tight because it's too long. So what we're going to do, if you want to focus more on one side than another, you can do two things. Very simply, you can just shift your weight a little bit one way as you roll through that, and that's going to put a little bit more pressure on the outside of that lower leg. The other technique that we can use is that you can work one leg at a time. And what you're going to do is that after you get rolled back to the knee, so let's have both of you guys come back, you're just going to take one leg, put it in front, and then nice and easy, you're just going to roll through the side that you want to spend a little more time on. And again, you don't have to be a marathon runner to be having some problems in that lower leg. Let's say you're a weekend warrior where you sit at a desk all week long, or you're doing your job and then you go out and you play real hard on the weekends. It's very common for there to be some issues. And this is going to be a great technique so you can manage your own body and you're not always dependent on someone else trying to help you out. So after 3 or 4 times, you know, we would switch legs. We always want to make sure we're working evenly between the two sides. And this is a technique that on the roller, if your roller starts getting a little older, or you're using it a lot, let's say you're using it every day, you want to position your body onto a different part of the roller, because if you're always doing this technique, because the shin bone is a very sharp bone, it can actually wear out the roller just a little bit. So to increase the wear of the roller, just move your body in a few different positions, and that will make sure that you're not just grinding away on one spot on the roller.
For some reason I'm getting dry.